And right now it's 6:40 minutes. That's how far some people will have to walk just to get their prescription medicine from another Walgreens.
Walgreens is planning to close its store at the corner of Teutonia and Capitol Drive next month. And this will be the third Milwaukee Walgreens to permanently close since just October. One man we spoke with says customers had no idea this closure was coming.
Most of us don't have transportation to get to the Walgreens down on 76th Street and the other ones. This one is essential. Walgreens, they're making a bad choice here, a bad decision. This Walgreens is essential.
Here are the other two Walgreens that have recently closed, one at Hampton and Fond du Lac, the other at West Forest Home and Lincoln Avenue. Walgreens says market dynamics, buying habits, and other factors are taken into consideration when deciding to close locations. Now, the latest Walgreens closure highlights a little-known issue of pharmacy deserts in Milwaukee.
Our Ben Jordan goes in depth on a study that shows the city has some of the worst disparities in the country when it comes to proximity to pharmacies.
For Latasha Langston, getting her medications is a necessity.
I got you. Okay?
But it comes with the same challenge each trip to the pharmacy.
How much of a time commitment is it for you to get to the pharmacy?
Anywhere from 1 to 3 hours.
Being unable to drive, Latasha has to catch a ride each time she needs a refill.
Does the hassle ever mean for you, I'm just not gonna come today?
Yes. Yes.
What does that mean for your health?
Oh, it could mean a lot because I'm on blood pressure medications. I'm on a lot of different medications that is very hazardous to my health if I don't take them.
Latasha lives in what's called a pharmacy desert. In most urban areas, it's defined as living at least a mile away from a pharmacy. But in low-income neighborhoods where a majority of households do not own a car, scholars say the threshold is just half a mile.
We're in one right now here at 35th and Capitol, the nearest pharmacy nearly a mile away.
I think the assumption is that most people live near a pharmacy, and that's not true.
University of Southern California professor Dima Cato studied pharmacy deserts in the 30 most populated cities in the United States. She found Milwaukee was one of these 8 with the worst disparities.
And what we found in Milwaukee, for example, majority Black or segregated Black neighborhoods, about 60% of them were pharmacy deserts, compared to less than 18% of white neighborhoods. So there's at least a threefold increase.
This heat map from the study shows most of Milwaukee's pharmacy deserts exist on the city's north side in majority Black neighborhoods. Dima says the primary reason larger pharmacy chains often choose to close pharmacies in low-income communities is because of the profit margin.
A lot of the pharmacies that are nearest to Black or Latinx neighborhoods, including in Milwaukee, serve a largely publicly insured population, either through Medicaid or Medicare Part D. And we know Medicaid and Medicare pay less, reimburse pharmacies less for their prescriptions that they fill for their beneficiaries. And that plays a role.
Dr. Hashim Zabak with the National Community Pharmacists Association knows that when pharmacies choose to close, customers end up paying the price, especially in Milwaukee.
The people in the zip codes in the inner city of Milwaukee are significantly sicker than other populations in other zip codes. They have a higher risk of diabetes. This has been proven. They have a higher risk of diabetes, higher risk of high blood pressure, higher risk of obesity.
Hashim fears more pharmacy closures are on the horizon unless something is done. Dima says there are multiple ways to prevent that from becoming a reality.
I think at the state level, we need to protect pharmacies at risk for closure, including independent pharmacies. But also, I think, improve and strengthen accountability for larger chains, for pharmacy benefit managers, to ensure that there's more equity in decisions being made on what pharmacies to close and which ones stay open.
It's an issue rarely addressed in Milwaukee, but one that has an impact on arguably the most important thing in people's lives, their health. Reporting in Milwaukee, Ben Jordan, TMJ4 News.